The main focus of the Jawaheer Lab is to figure out why and how an incurable disease like rheumatoid arthritis can improve naturally during pregnancy. Rheumatoid arthritis, or RA for short, is a terrible disease that affects approximately 1% of the adult world population, and that's probably over 50 million adults worldwide. And the disease is still incurable, and currently available medications can have terrible side effects. Surprisingly, though, during pregnancy, approximately 50 to 75% of women who have this disease improve naturally, and the remaining 25 to 50% can either worsen or the disease remains unchanged. So if we could understand how nature is making this incurable disease go away during pregnancy, we could use that as a model to come up with better and safer medications for this disease, which would help all these millions of patients worldwide who are living with this disease. Something else that is very important to women who have this disease when they're planning a pregnancy is that currently there is no way to know who will go on to improve during pregnancy and who will worsen. So when they're planning a pregnancy, many of them want to stop taking medications because these can be toxic to the fetus, but there's many now that are approved to be used during pregnancy because they're considered to be safe, but still many women don't want to be on any medications. They don't want their fetus to be exposed to these. And because there's no way to test whether somebody will improve or worsen during pregnancy, these women often are very concerned because they think that maybe if they stop taking their medications in order to get pregnant and stop taking it throughout pregnancy, that their disease may worsen, even if they would be among one of the women who may go on to improve during pregnancy. So there's a lot of unknown there. So if we could use our data and samples that we have to identify some biomarkers before pregnancy that could predict whether somebody will go on to improve or worsen, then those women, especially those who are going to improve, can make an informed decision to stop their medications without having to fear that their disease will worsen.